Welcome back to our channel. Today we're exploring whether tranexamic acid can reduce mortality in trauma patients with significant bleeding. Let's dive into the details. Does tranexamic acid, when given within 8 hours to patients with or at risk of significant bleeding, reduce death within 4 weeks of injury? Tranexamic acid improves survival when administered early in trauma cases with known or suspected significant hemorrhage. This synthetic derivative of lysine helps interfere with hyperfibrinolysis, a key factor in trauma-induced hemorrhage. Hemorrhage is a leading cause of death in trauma patients. Trauma-induced hemorrhage can result from direct injury to organs and blood vessels, as well as transient hyperfibrinolysis. Tranexamic acid, a synthetic derivative of lysine, helps interfere with this hyperfibrinolysis. It has been used in various bleeding conditions, such as hemophilia, cardiopulmonary bypass, and menorrhagia. The 2010 CRASH-2 trial, involving over 20,000 trauma patients, studied the effect of tranexamic acid administered within 8 hours of injury. The study found a 1.5% absolute reduction in mortality at 4 weeks compared to placebo. Notably, early administration, within 1 hour, was most effective, while delayed administration, more than 3 hours, increased bleeding deaths. Importantly, tranexamic acid did not increase the risk of vascular occlusive events. CRASH-2 was a multi-center, randomized, placebo-controlled trial conducted across 274 hospitals in 40 countries, enrolling 20,207 trauma patients. The primary outcome was in-hospital death within 4 weeks. Participants were adult trauma patients with hemorrhagic shock or at risk of significant hemorrhage, and the intervention was tranexamic acid versus placebo. Inclusion criteria included adult trauma patients with systolic blood pressure less than 90 or heart rate greater than 110, or both, within 8 hours of injury. Exclusion criteria were a clear indication or contraindication for tranexamic acid. Patients were randomized to receive either tranexamic acid, 1 gram loading dose over 10 minutes, followed by 1 gram infusion over 8 hours, or a placebo. Primary outcome data showed a significant reduction in in-hospital death within 4 weeks for the tranexamic acid group, 14.5% versus 16.0%. Secondary outcomes, including vascular occlusive events, surgical intervention, and blood transfusion rates, showed no significant differences. Subgroup analysis revealed that early administration of tranexamic acid within 1 hour of injury significantly reduced death due to bleeding, 5.3% versus 7.7%. Administration between 1 to 3 hours also showed benefits, but delayed administration, more than 3 hours, increased the risk of death due to bleeding. Criticisms of the CRASH-2 trial include the lack of measurement of fibrinolytic activity and incomplete data in the subgroup analysis of all-cause mortality. Despite these limitations, the study's findings are robust. CRASH-2 was funded by both public and private sources, including the UK National Institute for Health Research and Pfizer. In summary, tranexamic acid significantly improves survival when administered early to trauma patients with significant hemorrhage. These findings have influenced guidelines and underscore the importance of timely intervention. Thanks for watching. Don't forget to like, comment, and subscribe for more medical insights.